This video shows endoscope withdrawal from the level of the lower esophageal sphincter. This patient's a 39-year-old Caucasian female on chronic hemodialysis for end-stage renal disease, secondary to adult polycystic kidney disease. She presented with upper epigastric abdominal pain. Physical exam findings included visible swollen veins over the posterior thorax. This upper endoscopy was performed, which was largely unremarkable. The lower segment of the esophagus, visualized here, showed no pathology. However, on further withdrawal of the endoscope, esophageal varices come into view in the mid to upper esophagus. This is the classic location and appearance of so-called downhill esophageal varices. These varices are grade 2, protruding into the lumen but not obstructing it, and with no signs of hemorrhage. Several months prior to this procedure, an MRA of the upper extremities revealed the likely cause of these downhill varices. This patient had developed compromise of her superior vena cava, secondary to a thrombus around her indwelling hemodialysis catheter, and the obstruction caused by this thrombus is what likely resulted in these downhill varices. Blood supplying the esophagus is drained by both the azygous system and the portal system through the coronary or left gastric vein. In portal hypertension, elevated pressures through the coronary vein give rise to uphill varices in the lower third of the esophagus, a common phenomenon in cirrhosis. In contrast, downhill varices are due to superior vena cava syndrome, in which blood flow through the superior vena cava is obstructed for whatever reason. In SVC obstruction superior to the azygous vein, venous return from the head and upper extremities is redirected caudally through various collaterals and then into the azygous vein in order to reach the heart. However, this creates back pressure in the azygous vein. The resulting esophageal varices will be in the mid to upper esophagus. The designation downhill refers to the direction of the blood flow through the esophageal veins. Causes of SVC syndrome that have been reported to cause downhill varices include upper mediastinal neoplasms, such as lung cancers, thyroid carcinoma, thymoma, or mediastinal lymphoma. Vasculitis due to Behçet's disease and systemic venulitis can also cause SVC syndrome. And other possible causes include substernal goiter and mediastinal fibrosis. Or as in this case, the SVC can be compromised as a thrombotic complication of upper extremity hemodialysis access. Hemorrhage from downhill varices is far less common than hemorrhage from varices due to portal hypertension. As the most common causes of SVC obstruction are malignancies, most patients will die from their underlying disease. In some cases, if the underlying etiology of the SVC syndrome can be corrected, then the downhill varices may disappear.